Thank you. My name is Laura Tummon Simmons. I'm a naturopathic doctor who recently completed my clinical residency with the Canadian College of Naturopathic Medicine. Kieran Cooley is the other person who was involved in the study that I'm going to be discussing today, and he's the Director of Research at the Canadian College of Naturopathic Medicine. He's in a car right now somewhere. So he is unable to attend the meeting via a computer, and so he can't, for whatever reason, log in and introduce himself. So he is listening, though, and he's going to text me if something comes up that I'm missing in my presentation of the research that we've conducted. Currently I practice in Kitchener, Ontario, and I still have some involvement with the college. I was very graciously asked by Mitchell Zeifman to present today the research study we did on fourth-year interns at the college over the last year. So I guess we can switch slides, and probably you can skip this one because that's just the title of the study. Yeah, awesome. So in terms of giving you a little bit of a background to why we decided to do this study that we did, I'm sure everyone here has some knowledge of the fact that integrative and interprofessional patient-centered care is going to become more of a priority, especially in Canada. So the CMA and the CNA have sort of declared that they're interested in the conventional medical community sort of moving more towards a place of integrative care. And we know that with the WHO, the interprofessional collaborative practice is when we have multiple healthcare workers from multiple disciplines all working together to basically provide more comprehensive services for patients. And we know in terms of the research, interprofessional care improves patient satisfaction. It makes it so that the quality of care people are receiving is better, and it increases access to available health care. And what we do know is that if there are positive attitudes between practitioners, that those attitudes help us work more constructively together, versus if attitudes are poor between practitioners, that will often be detrimental to a positive standard of care for the patient. And so in terms of what we discovered in terms of naturopathic medicine and the research that's available right now in terms of interprofessional attitudes and the reflection on interprofessional care is that it's pretty much, there's very, very little evidence in terms of naturopathic medicine and interprofessional attitudes that's available. And so I guess we can skip to the next slide, but basically the current literature that exists really is reflected by sort of two studies, both of which were published in 2017, so before I even started, just after I started this project with Kieran. And so the first one was published out of Australia, which is a bit of a different situation because the process of naturopathic medicine is unregulated at this point in Australia, so a naturopathic doctor isn't a controlled title there, which is different than Ontario, where we are sort of doing this research. So in terms of, it was a semi-structured interview, so it was qualitative research, and they looked at the attitudes that naturopathic doctors, or naturopaths in this case, had towards medical doctors and collaborative practice. And as you can see, they summarized a set of boundaries to collaboration that were happening between naturopaths and medical doctors. They felt that there was a lack of communication that was sort of two-way between practitioners, so naturopaths often felt like they were really trying to integrate with the medical community but weren't receiving much communication back, that there was sort of an assumed indifference, so people felt like medical doctors were biased against the naturopathic community, that they often saw the theme where if a patient was successful with the naturopathic therapy, that it would be appropriated by the MDs without them receiving any training in the sort of alternative therapy. And that the medical doctors often viewed naturopaths as subordinate. So there was more of a hierarchy-based structure between the two of them versus them being sort of mutually respectful or on the same level. So that was the first study that's available. And if we skip to the next slide, there's a second study that came out, and this is actually an Ontario-based study. And it was primarily designed to look at the proximity between naturopathic offices and medical doctors' offices to see whether or not if we were closer in proximity, there would be more collaboration between the two healthcare providers. They did find that there was no correlation between geographic location and collaboration, but they also, as a part of this, did do semi-structured interviews to look at sort of qualitative attitudes of naturopathic doctors, and these were both done in sort of mid-sized cities in Ontario, Kitchener-Waterloo, where I practice, and then Sudbury, Ontario, which is up north. And they had very similar feelings as the prior study that I discussed from Australia. So same idea of being dismissed and not really feeling like they were in a collaborative practice with medical doctors. So you can kind of get an idea of that's it in terms of naturopathic attitudes at this point in terms of research. So in terms of the next slide, this is just little clippings of some of the headlines that are available right now. Especially in the last maybe 1 or 2 years, there's been a lot of media attention, at least in Canada, regarding naturopathic medicine, and often these headlines are quite negative. However, there's sort of an unclear climate in terms of how medical doctors feel about naturopathic doctors in the system. The literature that is available, where there's often studies of medical students going through programs in different places around the world, and most of the time, the most common limitation I was able to find in this literature was that medical practitioners often don't understand what naturopathic doctors do, and that seems to be the biggest limitation in terms of them wanting to collaborate with us. So I guess just sort of all of this setup is just meant to give you an idea of what we were sort of looking at as what was available in the research at the time when we were starting to look at this study. And so if we skip to the next slide, we initially set out to do a study alongside the Brampton Diabetes Trial, which is sort of a larger scale study that the Canadian College of Naturopathic Medicine is doing right now. And we were originally going to look at attitudes of interns towards medical practitioners and medical practitioners in the study towards naturopathic doctors. But because that trial has had such a long lead out, and they're still recruiting people, etc., and my residency was finishing, we decided to focus on just looking at the attitudes of interns towards other professions, because we know that those attitudes that interns will reflect will have an ability or will have an impact on what they're going to be like when they move into collaborative practice. And so a few things about the literature is we know that it had never been done or never been looked at. Those attitudes had never been looked at in a quantitative way before. So we only have data that's qualitative. And so we set out to design a study that was going to give us information from a quantitative as well as a qualitative perspective. And so we chose fourth-year interns. So these are students who had done 3 years at the college and who were in their final year of internship, which at the Canadian College of Naturopathic Medicine is pretty much purely patient care. And we looked at their attitudes at the beginning and at the end of their final internship year to see if attitudes changed as a result of patient care under supervision. So this was all designed around that. So you can shift slides. Yeah. So in terms of the methods for our study, we designed it as a mixed methods design, and there were sort of 3 big separate parts. The first was that we used the AHPQ, or the Attitudes to Health Practitioners questionnaire. And this is a validated questionnaire by Lindquist et al. And it has 20 different visual analog scales for each profession, to evaluate each profession, as well as the profession of the respondent. So interns were given 9 different professions to evaluate, including their own, so naturopathic doctors, as well as 9 other regulated healthcare practitioners in Ontario. So these are the ones who are regulated by some form of body, whether that's self-regulation or regulation by the government. And there's a whole bunch there, and I'm not going to read them off, but basically each visual analog scale they were given had 2 contrasting characteristics on either side. So on one side it might say that they would consider the profession thoughtful versus not thoughtful, or caring versus uncaring, and they had to mark on the bar where they felt that profession lay. And based on me sitting there with a big ruler and measuring each of these lines and then doing some statistical analysis, this would give us different quantities of variance that we could analyze. So basically that was the first portion, and that's sort of the quantitative portion of this evaluation. The second part was a demographic questionnaire that each student was given at the beginning and the end of internship. And these were sort of questions that would allow us to elucidate sort of who the student was in an anonymous way. So we identified, we asked for their identified gender, their age, as well as their self-rated experience in interprofessional settings, number of years where they've been a regulated healthcare provider, and then any forms of communication they thought they might use when they were in their internship. And then last but not least, we looked at a qualitative questionnaire. And so this was given to students at the end of the study. And this was sort of multiple choice questions that they were given to ask more about where those attitudes had come from. So we asked about sources of attitudes, their satisfaction with the interprofessional education they'd received at CCNM, what factors they felt might have contributed, what forms of communication they did actually use during their internship, and which professions they collaborated with when they were at school. And so they also were given a big area where they could write feedback in sort of generalized, in a generalized way. And the idea here was just to give us a better idea of where all these attitudes came from. And this survey was administered about like in the first month of their internship, so within the first 4 weeks, and then in the 12th month of their internship. Okay, so we can switch to the next slide. And basically, we included all naturopathic interns who were involved in care between May 2016 and May 2017. And they had to start the year in May 2016, so they couldn't start any later than that in order to be part of the study, and they had to be able to consent. So basic inclusion and exclusion criteria. And then in terms of, oh, we can swap to the next slide. Okay, so in terms of scoring the HPQ, I got to use a beautiful 30-centimeter ruler and measure each bar individually. I had a few people who helped me out for that process, but basically we were looking at then calculating 2 measures of variance. One was the surveys would tell us how caring the student viewed the other profession as. So they quantified that sort of caring variable as being caring, sympathetic, thoughtful, kind, those sorts of characteristics. And the other measure of variance was subservience. So this would tell us about how dependent on other professions the student felt that particular profession was, or how vulnerable that profession was. And so those were sort of the 2 measures of variance we used in order to score the HPQ. The second thing that we did is with all the questionnaires, we basically just did descriptive statistical analysis to get an idea of what the themes were amongst everything. So, and we can skip to the next, even more, yeah, awesome. So in terms of what happened, basically there were 131 interns we could use as a part of this study. When we did the first round of data collection, we received back 88 surveys, and in the round 2 of data collection, we gave those 88 people a survey and received back, I think, 77 of those. So in terms of, it was pretty good collection back. However, in order to use the HPQ and do a full round of statistical analysis, unfortunately, you had to have every single bar. So there's 180 bars in the survey. You had to have all 180 filled out correctly, and there had to be no sort of opt-outs at all in order to do the statistical analysis. And so as a result, we only had 46 students who completed a survey in both halves that was fully done. So unfortunately, it's a much smaller population than I would have hoped, but it's still a fairly good group that we received back. And we can skip to the next survey, or next slide. In this study, we received back primarily female respondents who are around 28.8 years of age, sort of within the 24 to 32 range generally. And in terms of distribution, the majority of the respondents had less than 1 year of healthcare experience, which meant that they pretty much hadn't entered from another regulated health profession. There were a few individuals generally as a part of the international medical graduate cohort, or people who had previously been nurses, for example, who had entered into the naturopathic profession, who had more years of service in a regulated healthcare practitioner group. But you can see that generally people were sort of inexperienced, female and fairly young, who entered into the survey. And so we can skip to the next slide. And so these are the caring scores as a part of the HPQ. So basically what this image shows you is that on the left-hand side is the intern's viewpoint of themselves, and then each of the professions in turn. And the first bars, or the darker gray bars, reflect the surveys that were returned the first round, and the lighter gray bars are the ones that reflect the surveys returned in the second round. As you can see, that the naturopathic interns felt that naturopathic doctors were by far the most caring. It's a bit hard to see from this image, but there was actually a fairly large differential, and it was statistically significant in all cases that we viewed ourselves as the most caring in data collection. In terms of other than NDs, nurses, massage therapists were the other two groups that were seen as the most caring in this analysis. Medical doctors and pharmacists, you can see, are quite a bit below, and they were seen as the least caring. In all cases, there was a shift to decrease, there was sort of a decreased caring score in every case except in the case of pharmacists between round 1 and round 2 of the data collection. So pharmacists were the only ones who slightly improved in caring score, but it was a non-statistically significant change. And generally most of the changes from round 1 to round 2 were not considered statistically significant. So there was very little change in opinion really from the beginning to the end of internship, which is important to think about when you're thinking about it as sort of a form of interprofessional education. And then we can skip to the next slide. So this looks a lot like the other slide, but this is looking at subservience scores. So this is how dependent on other professions we viewed each of these professions as being. We were also seen as the most subservient in our own viewpoint. But we were similar in subservience to nurses and massage therapists. So again, we're kind of lumped in the same crew. In this situation, the groups that were seen as the least subservient or dependent included medical doctors and chiropractors. And for the most part, there was no statistically significant change from round 1 to round 2 of data collection. So again, people mostly stayed where they were. Only one profession changed significantly, and that was traditional Chinese medicine practitioners, who were seen as being more subservient by the end of the data collection period. So again, overall, there hasn't really been that much of a change in attitudes. And so we can skip to the next slide. The next thing to consider, though, is we asked students at the end of the time whether they felt like their attitudes had changed over the year, and despite the fact that the majority of attitudes did not statistically significantly change after 1 year of clinic, 29 out of 46 of them, so 69% of them, indicated they thought their attitudes had changed over the year. So in terms of what this tells us one of two things. One is that potentially the survey we used wasn't the best in terms of elucidating that change, so maybe attitudes changed in a way that wasn't being reflected in the survey that we used. Or it just tells you that sometimes people want to view themselves as being changeable or potentially in a more positive light, and so maybe those students wanted to view themselves as more likely to interprofessionally collaborate than they maybe actually are, or they wanted to view their attitudes in a more positive way. So definitely we need to look into using other tools or designs when we're looking at these sort of changes in attitudes, but it definitely was interesting that people definitely thought their attitudes had changed even though they hadn't really statistically significantly. So we can change to the next slide. We also asked students which professions they collaborated with in their internship, and so as you can see, the majority of students who responded said that they collaborated with medical doctors. We didn't define the word collaboration in this case, so that could be reflective of writing letters to doctors, or it could be reflective of actually working on a team with a doctor. There was no sort of explicit labeling of the word collaboration because we just wanted to get a general idea of what came back, but primarily medical doctors were collaborated with. On average, people collaborated with about 1.93 other professions, so 2 professions. And the one concerning thing that did come back here is that 5 out of the 46 students who were asked these questions, so 11% of the group, indicated they'd had no professional collaborations in 1 full year of internship, not with any other of these practitioners. So from my perspective as a teacher and as a mentor, that is a bit concerning because I'm always pushing interns to collaborate with other groups. But especially because these are supposed to be graduates of the program. So in terms of graduating strong interprofessional leaders, we probably have some work to do here. We'll skip to the next slide. We also asked students to tell us what forms of communication they used, and primarily you can see here that letter was the most commonly used way of collaborating or communicating. Other forms were using the patient as a third party, for example. So in terms of collaborating that way, it definitely was another way to get information across, as well as telephone. We can skip to the next one because I think it's probably the most interesting one. The next thing that we did is we asked them where they felt their attitudes had come from, and primarily people indicated that their past health experiences were the source of their attitudes. So that's attitudes coming from their own experiences in rooms with doctors or pharmacists or chiropractors or whatever else. They also found that patient attitudes and experiences played a role, so what was going on with the patient, as well as supervisor attitudes. So supervisors being people who manage care for them in their 4th year of internship, as well as throughout the program. So from our perspective as an institution, really supervisor attitudes are the only area in which we have much control. So it is potentially a way that we can start to modify attitudes to be more positive towards other professions, but it is something that definitely we need to start doing more work with because of what came back on the surveys. So we can move on to the next slide. And students were also asked about their satisfaction with the IPE they received at CCNM. And as you can see, it's not a great score. I think we received a 4.2 out of 10, 10 being really satisfied. And so you can get an idea of that. Definitely there's some work to do. I would say as part of the community at CCNM, there isn't a lot of emphasis at this point apart from sort of more general discussion around IPE, and I think this is something that the school is wanting to potentially integrate more into the program, but we do know that it's definitely something that might be needed going forward. And then the next slide is not super important, but we'll just touch on it briefly. We sort of asked them for specific comments around the program as well in that general feedback section. And as you can see, some of these comments are fairly negative, especially people were commenting about potentially instructors having negative opinions, as well as that we don't do enough interprofessional work as a college, as well as potentially wanting to learn more about how to integrate with other healthcare providers other than MDs, because a lot of the focus of the program right now, especially for safety, is to refer to family doctors or other medical doctors, and so people were sort of interested in learning how to collaborate with other professions as well. And we can skip a couple of slides here to just finish up, so maybe to slide 26. And yeah, so what we gained from this study is we figured out that students were biased, so we were viewing ourselves as more caring than other professions, and the ones that were viewed as maybe less caring were considered more of the conventional professions, so pharmacists and medical doctors. What I will say is that the other studies that have used this validated tool, in all cases, the respondent discussing their own profession always views themselves as most caring, but typically with the various interprofessional education interventions that were used, when they restudied them, usually that discrepancy becomes less. So people view themselves more similarly to other professions. And in our case, that did not happen. So that's something to consider as well. And whether or not fourth-year clinics should be viewed as enough of an interprofessional education experience is a bit of a debate, but it is something that's important to realize that we probably can't just teach through osmosis. People need more integrative interprofessional education. And we know that their attitudes are formed prior to coming to the school, probably. And so while we know supervisor attitudes are a way we maybe can modify that, those attitudes, we probably need to start sooner. Just 1 year of clinical internship is not enough to modify anything. And we also still have students who are graduating who think they've interacted with no other professions. And for a lot of students, they're only interacting with medical doctors. So I think it's important to realize that as a community, we probably need to do more work around integrating with other groups. On the whole, that's pretty much it. I know I don't have very much time, but in terms of questions to pose to the group, or if people have questions for me, I think we'd be interested in knowing more about what sort of interventions people have integrated into their education programs for improving this sort of interprofessional attitude perspective of their students, because we're looking down the road at what sorts of things need to be integrated into the CCNM community. But I'm happy to answer any questions, and I don't think Kieran can chime in, but if he can here. Yeah.
So this is Liza Goldblatt, and I'm with the National Academy of Medicine, the Global Forum on Innovations for Health Professional Education. And I think in one way you hit the nail on the head, because one of the biggest obstacles we find, the entire function of the Global Forum is around interprofessional education and collaborative practice. And pretty much every healthcare profession in North America is at the table. And the Canadian Collaborative used to be very active as well. So all of us have found that one of our biggest obstacles are our own faculty.
Yeah.
Everyone has said that, and you're absolutely right. And it's usually the students. And one of the things that we have found is highly successful is getting the students to start coming together actually even in year one. So I thought I'd just share that with you, and also all the transcripts are available online and they're free to download. And I do know that Scaringa School, Southern California University Health Sciences, has actually sent several people to the IPEC training sessions, and of course you have some excellent training sessions there in Canada as well. You know, it's one of those things, you work together, and it's the best way to remove ignorance. But I thought I'd offer the issue of faculty, that what you're seeing is what everyone sees. And I think, again, you know, one of the reasons for IPECP is to begin to break down the hierarchy, you know, particularly mainstream conventional healthcare. It was also driven very much by the nurses. So I could go on and on, but I'll stop there. But that was a really interesting report. Thank you.
Thank you.
Hi, this is Martin Kidwell from Oregon College of Oriental Medicine. And Liza, you actually beat me to the punch, because I think that this is, it's the faculty attitudes towards interprofessional collaboration that is one of the biggest challenges and perhaps barriers to us making this happen on a larger scale. So, you know, I'd love to hear what others have to say, you know, about how to address this issue. But you know, as much as many of us have, you know, as we acknowledge that, you know, our various professions have, you know, experienced some, you know, bigotry or discrimination perhaps from the mainstream medicine, I think, you know, we also carry some of those attitudes within our own profession towards medical doctors. And I think, you know, certainly what I'm seeing is that is having a negative effect on our ability to educate our students on the importance of being open-minded and working with other healthcare professions. And in fact, our students are in many respects farther along in embracing interprofessional care than our faculty are.
No, absolutely. And it's definitely something that I think we're down the road, like this has been presented briefly to the faculty who are involved in clinic at the school in the hopes that people will start to realize that there are definitely are implications for maybe reflecting certain attitudes if they're happening. And also just sort of being aware that you can have an impact if you change what you're saying, that students potentially will listen and change their viewpoints as well. So yeah, definitely faculty are a part of the puzzle for sure. Are there any other questions? Oh, sorry.
I was just going to thank you so much, Laura and Kieran, listening and communicating, but not that we can hear, so for your preparation and for doing this study. And I think it will stimulate some more conversations that we'll have within the working groups. So we're just 1 minute over time, which is perfect. And if I don't hear any more questions, then I will bring the call to a close. And thank you again for your presentation. Very, very valuable information. Thank you for making the time and for being so clear. And to everybody else, I say thanks for being on the call, and you'll receive an email notifying you of when the next meeting dates are, and I look forward to seeing everybody soon. Take care.